with the budget. And that's what we're going to spend the majority of our time talking about today. And Tiffany, our policy director, is going to lead us through some of those highlights or top line points of the budget. And encourage you all too to ask us questions. If you need to ask questions and you want to put those in the chat, go ahead and go for it, and we'll do our best to answer them. If there's an issue you've been thinking about or wondering about, stick it in the chat. And then we'll also be talking some about school mask mandates and what's going on with that. I think the issue of kids returning to school and doing that safely has certainly been on most everyone's mind. And so Fawn's going to give us an update related to that and some of the stuff that NC Child is doing along that front. So without any further ado, I'm going to turn it over to Tiffany Gladney.
Thanks, Adam. Happy Friday, y'all. Adam's Freudian slip there about budget was spot on. I think budget consumed most of us this week. So please, yes, just to reiterate, to add questions to the chat if you have any. But if we don't know the answers, give us a little grace to follow up. I think most of us are delirious after reading 664 pages multiple times this week. So as you all know, this week we got one step closer to having a state budget as the House passed their version of Senate Bill 105 yesterday. It will now head to the Senate for a concurrence vote, and the next step in the budget process will be conference committee. So how I like to define this is when representatives from both chambers come together and they begin to negotiate on some compromise language. And then once they have finalized that language, they will release a new version of the budget, which then both chambers have to vote on before it can go to the governor's desk. And this is known as the conference report. So of course, we'll keep y'all updated every step of the way. That is all scheduled to happen next week, or conference committee is at least scheduled to convene next week. And we also had a few bills of interest move forward this week, so we'll tackle all of that. So let's talk about the good news in the House budget. We saw the creation of a separate juvenile justice division within the Department of Public Safety. We saw rate increases for foster parents to help recruit and retain qualified foster parents. Language from Senate Bill 93, which is assisting North Carolina families in crisis. This is the piece of legislation that would allow parents who have lost temporary custody of their children to retain their Medicaid coverage if they're making steps towards reunification. We also saw a big surprise, I think, for a lot of us, was the 8 weeks of parental paid time off for public school employees. We also saw raises for school support staff. So think of your custodians and your bus drivers to $15 an hour over the next 2 years. We also saw raises for private duty nurses who serve the Medicaid population. And then we also saw House Bill 736 added into the House budget. And this was a piece of legislation that would allow the state lab 3 years instead of the current law, which is 2 years, to add newborn screening test to its lab once they're added to the recommended uniform screening panel, also known as the RUSP, which is federally administered. We also saw House Bill 608, the Dignity for Women Who Are Incarcerated Act, implemented into the budget, the House budget. And this is that legislation that we've talked about in previous calls that would prohibit shackling and provide reasonable postpartum care for pregnant inmates who deliver while they're still incarcerated. So on the American Rescue Plan Act funds, the House budget allocated $150 million for testing and removing lead and asbestos from child care centers and schools. We saw substantial broadband investments to increase access to all 100 North Carolina counties, increase to access for telehealth and telepsychiatry, obviously in the wake of this public health emergency that we're all dealing with, and also funding for school psychiatrists, as well as various investments in resources for students in crisis. All right, let's talk about the not so good news. So we did see tax cuts in the Senate budget, but now also in the House budget. And we did not see the extension for postpartum Medicaid for new moms from its current of 60 days to 12 months. And this was included in the Senate budget, but it is not in the House budget. We also did not see a raise of the childcare subsidy rates or an increase of the availability of childcare subsidies as widely requested by the early childhood advocacy community. And then the hot button issue, Medicaid expansion, that was not included in the House budget. And we also didn't see the merger of North Carolina Health Choice, CHIP, the Children's Health Insurance Program, and the North Carolina Medicaid programs for children. And when this, later this afternoon, when the actual email update goes out, there will be a link where you can go and access our comparison tool, where we have compared the governor's budget proposal, the House, and the Senate, just to see where the chambers are falling when it comes to allocations that are important to us. So as I mentioned, we did see the movement of some other bills that we've been following and find of interest. So on the child welfare forefront, Senate Bill 35 moved. This is the bill that would raise the age to marry in North Carolina to 16 and would create a 4-year age difference limit for adults seeking to marry a 16 or 17-year-old. The bill successfully passed the House Wednesday and is now headed back to the Senate for a concurrence vote before it can go to Governor Cooper's desk to be signed into law. And on the health front, we did see House Bill 608, which I just mentioned, was also included in the House budget. That is the Dignity for Women Who Are Incarcerated Act. So this bill received a unanimous endorsement from the Senate Healthcare Committee this week, and it's now on its way to the Senate Judiciary Committee. This is very good news for the Senate to be working on it and endorsing it, and for it to be in the House budget means that the likelihood of this passing is pretty high. And then on the juvenile justice forefront, Senate Bill 301, expand expunction eligibility, which is legislation that would expand eligibility for criminal offense forgiveness, including up to 3 nonviolent felonies can be expunged, allow an attorney to request expunction on behalf of a minor, and allow district attorneys access to expunction records for determining conditional discharge eligibility. So the House did vote on this bill Wednesday and they passed it. So the bill now awaits the governor's signature. Federally, I mean, it's been a big week, y'all. So the U.S. Senate had a huge week with the passage of a bipartisan $1 trillion infrastructure package Tuesday, August 10th. The bill will address physical infrastructure needs across the country, which include broadband, roads, bridges, public transit, water and wastewater sewer systems. So the next step and this federal process is going to be the human infrastructure package. And the passage of this bill really lays the groundwork for negotiations when it comes to the human infrastructure package. And the human infrastructure will address issues such as healthcare, childcare, climate change, and so much more. So when you get the written update, you'll be able to click on a link there as well to learn more about those issues. So with that being said, Adam, I will pass it back to you.
Thanks so much, Tiffany. There's a lot to keep up with. We really appreciate your update and staying on top of things. I'm wondering now, I've got a couple questions, but I'll wait and see. Do we have any other questions that have popped up, Fawn?
I don't see any questions in the chat. So folks, if you want to know more about the budget, we kind of just skimmed across the surface there. So Please enter your questions and comments in the chat, your complaints, gnashing of teeth. At the office this week, we've been calling it the annual dashing of hope when the budget comes out. So if you're feeling that with us, feel free to share some of those comments in the chat. But Adam, I don't see any comments in the chat right now. So if you want to go ahead and ask your questions.
Well, first I wonder, I'm going to put you on the spot, Stephanie, and you can decline too. But I think the stuff for Ready's been pushing for got in the budget from Guilford County. Can you talk just a second about that?
Sure, I'd be happy to. We are very pleased and stunned that we have made it into the budget. And so we had two legislative requests. One is for an early childhood workforce project that would look at 8 early child care centers in Guilford County, choosing for socioeconomic and all those things, and look at ways to take the model work standards and apply them to the centers, look at ways to increase teacher professional development, some wage supplements, and follow the outcomes. So that was one project that at this point, knock on wood, is included in the House budget. The second is for an integrated data system that we're working on that will allow families to own their data. It will allow providers to have access to the data, and it will provide a seamless handoff for different programs. So it will be able to track progress across the programs and make it seamless so that you don't have to fill out the same forms over and over again. Our plan is also to identify gaps. So 1 year of funding for that was in the House budget. So now we are having our fingers crossed in a big way that it makes it through the next phases.
Yeah. Well, thanks for sharing that, Stephanie. We had noticed that, and I just think it's interesting, and I don't know exactly how that came about, maybe, but I think it's one of those situations too, where, in case folks don't know, one of the key budget writers on the House side, somebody that really gets in there and is able to have a big say in things, is Representative John Hardister from Guilford County. And so, it may be one of those situations, or this is something you see a lot of times, is if there are key representatives or senators that are in the know and can get things in the budget, it can help you out sometimes. So I wonder if that's, had a lot to do with it.
Well, I think one of the things I'd really like to point out is that these legislative requests were developed with the Chambers of Commerce for High Point and Greensboro. So it was part of their legislative request. So they're the ones who carried the water really for us on these requests to the General Assembly. So they've been really great to work with. So I'd like to promote that highly for anyone else. It has just been a really great thing to work with the chambers on this. And I think the nice thing is, because we have 2 major cities in our county and both chambers included this in their top 3 priorities, that was something that I think helped, as well as, Adam, you make a really good point about, the Guilford delegation. From the start, the chamber worked very hard with the Guilford delegation to ensure that they knew what the priorities were for the 2 chambers in our area.
Yeah, thanks for sharing that, Stephanie. I think it's always important for folks to kind of, Fawn, is there any other questions that popped up?
Just kind of some comments around early childhood education. Tiffany covered this, but just to make sure folks know, House Bill 574 to raise those subsidy rates was not included in the House budget, nor in the Senate. And I think one of the trends we're seeing across early childhood and lots of other areas is we have lots of one-time federal money coming in, and legislators have to spend that money out. So you're seeing one-time grants, one-time allocations, one-time sort of infrastructure chunks, but in terms of sustainable, non-recurring, long-term funding, Republican leadership in the legislature really decided early on, this is the amount we're going to spend in the budget. We're not going to go over this small amount of percentage increase from past budgets. And that really puts a damper on, any kind of salary spending, any kind of long-term programs. And, I think disappointed is a really nice word for how I'm feeling. I'll speak for myself. And I think lots of other folks who are tracking early childhood and lots of other issues. I think mental health is in the same boat, right? Where you're seeing one-time pilots, one-time grants, one-time local expenditures on things, but not the long-term recurring state investments that we need to see in these programs. And grateful for the ARPA funds, grateful for the one-time relief spending, but that doesn't keep programs going for the long term. And we have kids and families for the long term. So that's what we need to see in a state budget. And so if you haven't heard the frustration in folks' voices, you can probably hear it in mine. This budget is not getting the job done for kids and families. And that's really our message on this. Lots of one-time things to be happy about. A few things we're still trying to get done. Quite a few things we're still trying to get done, but that long-term sustainable funding, it ain't here.
And, you know, I would love to hear, Jenna, if I can put you on the spot, you know, I'd love to hear a little more about the early education, just sort of where you're seeing everything standing right now, and like what are the advocacy opportunities we may have through the negotiations over the next few weeks?
Hey, Adam, thanks so much, everybody. I was just letting Michelle know that I have a breakthrough case of COVID. And I have two children who have COVID. So I really wasn't wanting to speak, but I'm happy to do so. So yeah, we're also very disappointed. One small bright spot was that Representative Willis did include wages statewide. Unfortunately, it is part of the ARPA money. So again, it's this lack of long-term investment. But what we're hearing right now in the early education world is that what was really bad 6 months ago is that it's in a dire place. Centers are not able to open, families are not able to access care because they don't have teachers. And so Representative Willis, who himself is a childcare owner, you know, he understands that without a workforce, he can't open his doors. And without childcare, none of us can go to work. So we are incredibly disappointed in the lack of long-term investment, but there is a bright spot that at least, you know, that passed without any arguments, without any discussion. You know, legislators are at least aware. So let's keep pushing. So Adam asked me about advocacy opportunities. So thank Representative Willis. Ask for that to be included, but then also ask for 574 because we also need rates in order to continue to build the workforce and support the workforce. And finally, again, the tax cuts are not doing anyone any favors. We understand tax cuts, we understand the logic behind them, but we have such an incredible opportunity right now, and our system is so fragile, it's going to fall apart without investment. So definitely lots more advocacy opportunities, and thank you all, and please stay safe and wear your masks. This Delta variant doesn't seem to care if we're vaccinated. I mean, I'm so much better than I would be if I wasn't vaccinated, but just stay safe, everybody.
Gosh, thanks, Jenna. We're really sending healing thoughts your way, your family's way. Let us know if we can do anything. Any other questions, comments?
Well, Adam, I would also add to Linda's question. Once the conferees are announced, it's slim, but there may be a little opportunity there to work some of the conferees to see if we can get 574 added to the conference report or something similar. Again, that is very slim chances there, but there is a small possibility there that we could do some negotiating on that front.
I did just drop the Early Education Coalition's action alert on this into the chat. So you can find that link there if you want to take action and contact your legislators right now. Jenna, sending you lots of love and wishes for quick healing. I hope your babies are fine and y'all get better quickly.
And Tiffany, I appreciate you saying that, because it's kind of like, yeah, like if we, you know, collectively can push a little bit. I mean, one thing we all know is that we are in just such a dynamic situation with the world these days and what's going on, and things change from week to week. And, in 3 weeks, people may be thinking even more pressingly about what's going on with the child care system and everything else. We really just don't know. So I think it's smart that we keep some options out there on the table for sure.
I have a quick question for Elizabeth Byram. I think Elizabeth is here with us on the phone, but I'm curious about whether we have a sense of how much of the flexible ARP spending for early education has already been allocated, or whether some of that money still remains outstanding after this budget goes forward.
That's a great question, Fawn. So just to give folks an update of all the moving pieces with the ARPA dollars for childcare, if you remember and have been following, there were a couple buckets that we saw, and a couple of those have already been appropriated. So just as a reminder, the new stabilization grant program, which is about $805 million, has been appropriated, and we are waiting for the Division of Child Development to roll out that process, hopefully in the next couple of weeks. It's going to be an application process this time where providers have to sort of apply for these grants. However, there are going to be a lot of supports in place to support providers to make sure they get those applications in and are able to get the money to their programs and to their staff. What we do know is that that program is going to have a couple different buckets of priorities. One is around fixed costs and also supporting families with scholarships if they need them. The other is really focused on the workforce. So making sure that teachers get additional compensation supports. And so providers will have those options to really invest in all the ways they need to keep their businesses open. The other half of that ARP investment, which is what we saw in both the House and Senate versions of the budget, is the $503 million. It's more flexible. And to your question, Fawn, we actually saw a little bit more specifics in the House version on what that might be used for. Again, sometimes it's recommended, sometimes it's more prescriptive. We'll have to wait and see what the final version is in the conference report, but the House recommended that $503 million be used for a couple items, some of which reflects the priorities of the division and the governor, some of which reflects the priorities of advocates. But a large portion, about half of it, is for extending subsidy to more families. There is about a $50 million to $59 million amount for modernizing databases and technology, which is sort of a Division of Child Development priority. There's a portion to continue covering the parent copays through the end of 2021. That's about $30 million. And then the last portion, which Jenna alluded to now, includes the recommendation to make sure that $35 million is used for the wages salary supplement program. The rest of that money, about $212 million or so, is for workforce development strategies, of which wages is an important one. So we'll have to see once it goes back to the Senate if they align with sort of the recommendations. Their original appropriation was sort of just really vague around, let's use this for childcare subsidy extension and not some of the other important supports we need in the system.
Thanks, Elizabeth. So there's still some flexibility there about what DHHS could be doing with this money, but again, one-time money or short-term money, not long-term state appropriations. Thanks. All right, Adam, I am not seeing any other questions in the chat. Lots of good wishes for Jenna and her family in the chat. And, we know lots of other folks. I'm sure everybody is sending good thoughts and healing to lots of other folks who are dealing with this too. So, hearts are with you, Jenna and family.
Yeah. So Fawn, I guess we'll turn to a COVID related topic, which is masks in schools.
Yes, thank you. Just something we wanted to bring to your attention in the update this week. I'm sure you all know that the governor has left it up to individual school districts as to whether they will be requiring masks for students and staff this school year. You've probably also seen in the news lots of COVID outbreaks in the year-round schools that have already started for the year, particularly severe in schools that don't have mask mandates. And we've seen a couple of districts actually reverse course who had adopted mask optional policies and changed course to require masks going forward, which is great. Damage is done a little bit with some families, and unfortunately, but there's some school districts are changing. So Statewide, the mix is we have about half of our school districts have mask requirements, about half are mask optional. There's a real urban-rural divide there. You really see the rural school districts with the mask optional policies. So in terms of the numbers of students covered, about 30% of students in the state will be going to school with mask optional policies this year. So we want to first thank the North Carolina Pediatric Society for their leadership. They sent out letters to all the school boards in the state last week, urging them to require masks. And following up on that, this week, NC Child is reaching out to school districts across the state, particularly focused on those who didn't have a policy yet, or those with mask optional policies, to say, we want you to put a mask requirement in place. We know that masks work, and we have to stop this from spreading, and we want kids in school. I mean, I think that's the bottom line, is that we don't want to go back to school closures and mass quarantines that we saw last year. It's terrible for kids. It's terrible for their mental health. It's terrible for learning. It's terrible for social emotional health. So we want to minimize that. And until everybody's vaccinated, and probably even beyond that, masks are really the way. So any rate, want to put this in front of you all in case you are in one of those districts with a mask optional policy. We have a model letter that you can use to send to your school boards. And we have the policy tracker from the School Boards Association about which policies have which districts. So I'm going to drop that link in the chat, and we'll also be sending that out to you in our written update today. So really want to encourage you all to reach out to your local school boards if you haven't already done so.
Yeah, thank you very much, Fawn. It's such an important issue. And yeah, if folks live, again, it's an opportunity for local advocacy as well, you know, talking to your school board members, encouraging other people to do the same. That and ARPA advocacy is another opportunity for local advocacy as well, for what your city, county, school board is doing around the use of American Rescue Plan Act funds. And of course, we have a lot of resources on our website related to that as well. Do we have any other questions that have popped up? Okay, seeing none, I am now going to ask if there are any announcements. All right, hearing none, thank you all for joining us this week. We really appreciate it. Next Friday, we will have an update as well, and we'll see what there is to report. I think next week will be kind of a weird week because, you know, the conferees will be doing their thing behind closed doors, but I'm sure there'll be some other things going on as well that we can update everyone on. So thank you very much. Have a wonderful weekend. Take care.